and welcome to this webinar today, which is a really important one in relation to the development of research for nurses and midwives linked to the CNO strategy. My name is Mark Radford. I'm the National Director of Long-Term Workforce Plan Delivery and Deputy Chief Nursing Officer. I've been working nationally with Ruth and the team in the development of the CNO strategy. I'm delighted that Professor Jo Cooper will be talking a little later to give an update in relation to work that has been ongoing in relation to the CNO strategy and delivery, but also importantly how this links to the work that has been undertaken. And firstly, thank you to the team who have been working to develop the SORT tool, which is a really key part of what we're aiming to deliver. So we've actually got a number of colleagues joining us from the development team who have developed this that is linked to a panel a little bit later on. The slides will come up in a moment. So it is great to have here today. Obviously, Jo Cooper. Jo works nationally in the National Nursing Team, supporting Professor Alison Richardson in relation to the delivery of the CNO strategy. In addition to that, today we have, next click. We have Professor Ali from Sheffield, who has been doing a huge amount of work in the development of the SORT tool. Next click. Professor McGarry as well, who's again, and finally Professor Cook. All colleagues have been doing a great deal of work in the development of the SORT tool for developing nursing research capacity in healthcare organisations. And obviously colleagues will be on a kind of live chat panel discussion around about 1:30. So please, colleagues, you're most welcome to put forward questions. So the plan of the session today is to give a brief update on the CNO strategic plan, in relation to also importantly the SORT tool that we have been developing in collaboration with our university partners. Next click. Next one. And then an opportunity for question and answers with both national and university leaders in relation to the implementation and questions for the SORT tool. There are some ground rules today as part of the chat. So I know, colleagues, we've got a number, possibly over 200 registered for the event today. So please keep on mute if you can. Please add comments and questions to the chat box. And of course, when we get later on to the Q&A, you'll be able to kind of raise your hand and the team will be able to kind of pose any questions to the panel a little later on. Slides and recording will be made available. I know that this is being live streamed to YouTube at the moment, so it's a great opportunity out there to collaborate via social media and other platforms to ensure that we've got and reflect the rich discussion that we have today. So colleagues will be familiar with the CNO strategic plan. Before I ask Professor Jo Cooper to give our initial presentation, I think it might be useful for colleagues to understand the kind of genesis of developing the SORT strategy. Was developed through a huge amount of co-production across the university education life sciences sector to really develop a comprehensive support and vision over the next 5 years to support the development of nursing midwifery research. Now, obviously, a key part of that is very much recognising capacity and capability. As Jo will go into in much detail in a bit, the plan is really moving forward with a lot of engagement from both universities and providers and support from government in relation to this, including our agency partners such as the National Institute of Health Research. The fundamental issue is, of course, that the quality of the healthcare that we provide in the NHS and social care is really intrinsically linked to research endeavour and how we utilise evidence. NHS collaborates a lot with academic and commercial and public partners, developing and research and innovation to really ensure that we're able to deliver better outcomes for patients. Now, the evidence base, as a profession, is really pivotal because actually the use of evidence base in terms of our clinical decision making, as well as also advancing our capabilities in terms of treatment and options to deliver for patients, a key part of that is ensuring that we use all of the skills and experience that our nurses, both at university and provider level, can give to deliver in relation to research itself. Now, nursing research in the UK and globally has really moved forward over the last decade or two, particularly in terms of cultivating research capacity and capability. But this really required a strategic overview through the CNO strategy to ensure that we were gearing all of our efforts in a focused set of actions to ensure that we were able to deliver a step change in the capability of research across England. So the self-assessment tool was a really important key component of that. And I've kind of talked much around the kind of collaborative nature of work that goes on between universities, life science sector, and also the NHS. But the self-assessment tool the team have developed is really fantastic because it is very much around ensuring that the collaborations that we want to create between the academic community and the NHS provide a really clear framework for organisations to assess their readiness to be able to deliver this. And also importantly, reflect the successes they've had and any gaps that they may, but also in terms of what other relationships might be really important to ensure that we're able to deliver it. So I just want to say thank you to the team that have contributed to its development. It is much anticipated and a really important step forward in relation to developing and delivering the CNO strategy. So I'll hand over now to Professor Jo Cooper, who is going to give us an update in relation to the CNO strategic plan before we move on to the panel discussion.
Thank you, Mark. And just can we say thanks to you for your support and leadership. I know you're working very much closely on the workforce training and education and the long-term workforce plan, but you've been pivotal in your support to us too. So we just want to take that opportunity. Hopefully, Parveen, there'll be some slides shared. Thank you. And on behalf of the CNO research team, it's a real privilege today just to give you a whistle-stop tour. There is an email at the end, and we'd be delighted to connect with anyone who has any feedback or would like to be involved further and to hear and to continue to learn, because this really is a work in progress. But my job today is just a little bit of an oversight, an overview of what we've been doing, just to refresh you and also to consider how this links to SORT. And so this is the team, the CNO research team, my counterpart, Professor Alison Richardson. I believe Alison's on the call today, and I have seen Eleanor Hovard. I'm not sure if you're on, Fiona, but Eleanor and Fiona have finished their secondment with us, but I just wanted to acknowledge their major contribution to the SORT tool too, and the wider work of the CNO research strategic plan. Next slide, please. For those that don't know, hi Fiona. For those that don't know the area, we have 5 strategic areas of focus of the strategic plan, as Mark has alluded to. This was co-produced and remains continually developing around aligning nurse-led research with public need, releasing our research potential, developing the best research system, thinking about future nurse leaders of research, and digitally enabled nurse-led research. And I hope you see the clear links between these and the elements within the SORT tool, because that has been a clear and very valuable driver. Next slide, please. And here it's just really around considering, so what are we aiming for? It is about a people-centered research environment that empowers nurses to both lead, participate in and deliver research, so that we all have that part to play. Of course, there is a desire to develop careers and the clinical professors of the future, but also equally important is to embrace the valuable part of both engaging and using best evidence, but also supporting the delivery of research within trials and so on, and the leadership component as part of that. So I leave that there for you just to get a sense of how it really aims to consider all key parts and contribute to our national vision for research for our country, for the benefit of our public and of course our staff too. Next slide, please. And as I mentioned, leadership, which is also key to SORT, has recurrently come back to us whenever we talk to colleagues. I'm sure you would feel the same, that it really is about how we inspire, empower, we create that shared vision, and we lead this change together. So we're on a journey with SORT too, as we are with a plan, thinking about how we make best use of our teams and our assets and working with our public, and then articulating the impact and change that we have with that. And so with that in mind, just on the next few slides, or just the next one, please, Parvin, wanted to give you a flavour of what we as a team have been doing in the leadership space in partnership with our communities and our ICB and Chief Nurse colleagues. So looking at the top left hand of the screen, we are working and looking to support the ambitions of the long-term workforce plan, considering how we really create and cultivate that environment for our learners and the educators and those that are entering and developing within our profession about that research pillar and how that really creates the best environment within which to learn, but also to deliver care. There is a refresh of the Executive Nurse Handbook underway, and so Alison and I have been contributing to what that might look like, thinking of the support that our executive nurse leaders really need as they develop into role, but also as they are in role. And I'm sure many people on the call today are already supporting their leaders in practice, bringing our research expertise. And I think SORT has real potential to help and support our leaders in, as you can see on the right, some learning that we had from the Florence Nightingale Foundation commissioned piece from us on how we help our executive nurse leaders make research matter. Towards the left again in the second line, Alison and Fiona led some work around research and appraisals. We're still looking to develop that further, subject to business planning in the future, but considering, and the call to all of us, I suppose, is how do we really bring that alive in our appraisal systems and show that through our revalidation. So we have some plans in place, and we'll certainly update you once we have those more secure. We work closely with Helen Bolsden, the acting CNIO for England, on digital nursing research leadership, and with colleagues, for example, in the Northwest, who have a digital nursing research network, really about how we maximise the research leadership already in place, but create that environment where we can use data and use it for research purposes. And then at the bottom, the research contribution to the CNO vision for England. Next slide, please. Another key piece of work, and thank you to those on the call that have either led or contributed to this, will be out shortly, we hope. It's a research toolkit for matrons, health and care leaders, those pivotal leaders who day to day, 24 hours a day, are really helping create the environment. And I've listed there for you the 5 key areas that have been co-produced and very much driven in partnership with a real community of practice around understanding research, understanding evidence-based practice, enabling a research culture, understanding research delivery, and the clinical academic research career. So we hope to have that out, if not late summer, early autumn. And then finally, we're coming towards the multi-professional practice-based research capabilities. That is out, was started by HEE, now NHSE, and the Centre for Advanced Practice. On the next slide, I can show you here that it really is about time that we focused on that research pillar of practice, and this tool is phenomenal in helping us understand what that might be from entry to consultant level practice, and help go in partnership with the SORT tool and things such as the Karen survey that takes place. Next slide. And just to identify that there are key areas and real capabilities that if you go online, we can share it if you don't already have the link to that. That is really its heart around transforming services, outcomes and experiences through research, and then goes from both those entering our profession and unpacking what it is around advanced level and consultant level practice. So thank you to the team that have helped bring this alive. Next slide, please, Parvin. I wanted to just assure you that we work in partnership. This is a research strategic plan for the nursing profession, but we work and have worked very closely with the midwifery team around the CMO's research strategic plan, the Allied Health Professionals Research and Innovation Strategy for England, and of course with Professor Ruth Endicott and team at the National Institute of Health and Care Research around that new investments. And I'd encourage you to look, I've put on the next slide for you that I hope that the QR code may well still work, but there is now a central landing page for this £30 million of investment per year for health and care professions, where you can really consider your SORT assessment and look in terms of developing those who engage and lead research across from undergraduate and pre-registration and insight programme all the way to advancing careers and real investment in allied health professions too. So I won't spend much time on that, but hopefully you'll find that as a really useful resource. And the call for us now is to really maximise and make best opportunity from this great investment. Next slide, please, Parveen. And we are undertaking and have over the last few months commissioned a review, a bit of a stock take, time to reflect and consider 2.5 years on from that launch way back in November 2021 in the height of the pandemic. What's working well? And what under those 5 key areas are really important for us to consider. So we really have worked with Florence, who are doing a phenomenal piece of work. That's due around mid-May. So we'll bring it back and think about how we take forward some learning for the next 2 to 3 years. Next slide, please. So thinking best research system, coming back to SORT now, this was really a call. And as on the following slide now, it really started at the outset, actually, of our journey on the strategic plan for research. When a CNO from an NHS trust said, that's great, but I need a tool to help me assess how my organisation is doing. How do I know where I'm starting from, and how might I know where I'm developing to? So I'm going to now, with great pleasure, hand over to the team that we commissioned. It was a 2-phased piece of work, which you'll hear around, of a self-assessment for organisational readiness, and really exciting development for us as a community to come together and to come together in a multidisciplinary approach. So thank you, Parveen, Jo and Julie, and the wider team, and anyone that's contributed from my perspective and from Alison and the wider team. Next slide, please. There's our email address. Please feel free to reach out, want any further information and any further involvement. So thank you, and thanks for listening.
Okay, thank you. Am I okay to go ahead, Mark?
I'd go ahead, Parveen.
Okay, thank you, everybody. And thank you, Jo, for an overview and to describing what has happened in the background. And thank you to Mark as well for the introduction and for leading this session today. So what I'm going to do, I'm going to talk about the story so far. So just give you, I'm not going to go into a lot of the details as to the methodological details, but well, I'm saying it, but you never know when I start talking. So what do I do? So, but I'll give you a whistle-stop tour of how we have developed this and where we are with it right now and what is the plan for future, if that's okay. Okay, so if I can move my slides. So as you know, the overall aim of the tool, and as Jo have said, was to develop a research readiness tool to help develop and monitor an organization's progress in supporting research capacity development in nursing. We started off with nursing, but there's a lot of interest from other healthcare professions, especially all the NMAP professions. And many people ask this question that why is it only about nursing or for nurses? And is it applicable on others or not? So it is applicable. It's always a good practice to start off something from a very specific group, and that's why. And because it was done at the back of a nursing research strategy, that's why it was focused on nurses. However, the development has involved colleagues from other professions, and looking at the literature, looking at what we have done so far and how it has developed, there is no reason to believe it wouldn't be applicable to other professions. But we may need to do some psychometrics and checking to just make sure that we are not making false claims. So yeah, if you would like to use it, please do get in touch with us. So in terms of methods, it has gone through around 4 phases. Phase 1 was Delphi, and then psychometric testing, then development of maturity metrics, and the guide development. And I'm just going to go through all of them kind of in a very quick way, not in a very detailed way. So phase 1 was a Delphi survey, which involved various different stages, starting off with the expert working group. And so 3 rounds of expert working group and 2 rounds of Delphi survey, in which what we did, we developed statements through the literature. We developed statements with working with the expert working group to try and come up with things that, and looking at the research strategy. So we started off with that. Then we went on to Delphi survey, where people were able to look at those statements, say, are these important or not important, suggest other statements and things like that. So the idea was that any statement, those who are aware of the Delphi approach, any statement which takes up to 70% of agreement of the participants would go into the tool, and those which do not achieve that sort of agreement are going to be discarded, or going to discarded at the end of Delphi survey too, but to be included, modified, improved, and to be included into the next survey. So as a result of the whole process, there were 60 statements which were included in the final sort prototype developed at the end of stage 1. There were only 2 statements from digitally enabled research section which made to the final tool, as opposed to 10 statements. And we as a team felt at that time that it was not because of the statements were not important, but maybe because of the composition of the groups that we were working with, and maybe due to the type of participants and their exposure and confidence with digital skill was affecting their ability to comment on the statements. So therefore, we then followed the same 2-stage process, which I've just mentioned earlier on, for the digitally enabled section of research. And the survey was then sent to a group of participants who then had a look at all the statements, and as a result, all 9 statements were reached consensus and were included into the final tool. So the next stage was we wanted to make sure the tool is robust enough and it is measuring what it is supposed to measure. So we wanted to look at the psychometric testing of the tool. Therefore, we created a survey which went round to people, and 193, more than 200 people participated, but the data was analyzed for 193 participants, and which resulted in identification of 44 statements. So reducing it down to 70 odd statements that we had at the end of stage 1. And there were some more statements which were added, because when we looked at the statements, I thought that something needs to be added. From that to 44 statements and 5 factors. So this is the principal and component analysis is a method that we use, and that resulted in these 44 statements in 5 sections. The idea usually is that when we write statements, we think they are measuring what we think these are measuring, but we are asking those questions from the perspective of questionnaire, not from the perspective of respondent. So the factor analysis helps you understand how respondents have perceived the statements and how they are linking things together, and then how do you group these things together. So 5 groups are identified, and you can see from the Cronbach alpha for all of these factors that all of them have got good reliability and good factor loading, and the overall the Cronbach alpha for the overall scale is 0.969, which is really very, very good. So which means it's a robust tool for the population that we are using it for. So these are the 5 sections. These were initially aligned with the research strategy headings when we started off, but when we have gone through all the process, then we thought that they were not directly aligned to it, so we had to rejig it, and we had to look at what those specific groups were asking or telling us about. And these 5 groups are releasing potential, which talks about spotting talent, enthusiasm and resilience, learning by doing, training and research skills used in practice. And it also covers understanding the importance of an enabling environment for research careers. Embedding research talks about reducing barriers to research-related activities by providing time and resources, and also talks about making research legitimate in the organization, recognizing its impact and the contribution of nurses. Linkages in relationships talks about forming research link outside the organization and promoting nursing research leadership to influence the wider research agenda, not only working one particular profession, but across the profession and the healthcare system generally. Inclusive research delivery refers to activities related to supporting public and patients' involvement in research, and also covers engaging the wider nursing workforce in delivering the research and making contribution of nurses or any of the professions that we talk about visible. And the final one, as the name suggests, digitally-enabled research relates to research leadership and skills in digital technologies and data science, including the skills needed to undertake research and service development. And you can see the number of statements. The first one has got 22 statements. The second one has got 5, then 4 and 4, and the final one has got 9 statements altogether. Thus 44 statements that we have into the tool. So this was the second stage. The third stage is then development of maturity metrics, because what we wanted to do is to provide an assessment tool for evaluating and for helping people to have that tool to evaluate their organization level of progress towards the goal, and how do they identify various levels where they want to, their organizations is or where they're working. So this resulted in a maturity metrics with the 4 levels. First is not yet planned, which means that you get a 0, which means nothing is under consideration. There's little awareness and no planned activity. Plan means some awareness of the need. Planning is underway. There's some evidence of early activity based on plans. 2 is activities happening, and 3rd is activities evident and expanding, and 4th is activities embedded, and you need to monitor and review the progress and maintain it rather than establish something new. So these different levels then would allow organization to develop their plans to achieve any particular group of activities. That, so for example, they may want to do a digitally enabled research and want to do something around that, or they may want to focus on a particular area in the organization, let's say emergency department or endoscopy department, who may not be giving the results and showing you that their maturity level is slightly less than what you expected. So it helps you then plan accordingly. And then the final was SWOT guide development, because what we wanted to do was to provide a guide that should allow people interested in organization interested to use the tool as it is intended for, or at least give them a guide. And even if they wanted to kind of, slightly use it slightly differently, there is something that they can measure and say, this is what it was. This is how it is used, and this is how we have used it. And that was also developed through 3 iterative interactive online workshops to develop the content and layout. And we did get feedback on the prototype guide from 15 participants I've mentioned here. But then there have been iterations within the research stream and the team that Joe has mentioned, and colleagues, to just make sure it's readable, it flows well, it is useful and effective. So the SWOT guide contains, the content of it is frequently asked questions, things that you probably want to know about. It tells you about how to use SWOT as a framework for joint reflections or validate or as a validated measure as a questionnaire, and it helps you to think about how to develop improvement plan and suggestions. And this then takes me to the website, where I'm sure you must have tried to see it. Can you see my screen? What do you see?
Just see the slide with a link on.
Yeah, at the moment we can't see the actual web site, Parveen.
Okay, so okay, I thought so, because it's not going to show you the screen, and I need to reshare it. So just now, what do you see?
Yeah, got it.
Okay. So this is the website. I'm sure you would have the link for it, and there's a link into the presentation, and we can share the link as well if you would like. And this provides some introduction. You've got my right and left are not very good. So where it says content, below this, you've got various sections and hyperlinked to, these are hyperlinked to various sections you can go to. It talks about introduction to SWOT, what are the key resources that you need or are available, and there's a link to download those key resources. It tells you about how the SWOT should be used, and how you can use it as a validated measure. It gives you details about maturity metrics. There is a slight errors here in score 1 and 2, and we're sorting that out. So please don't panic when you see that. It also then tells you about how to use maturity metrics, where you're going to be able to use it and how to do it. And if you click on the key resources, it takes you to a place where you have got downloadable versions of these resources, and especially the templates, example of evidence template, improvement plan template, and the checklist for the SOAR process, as well as the SOAR tool itself. So hopefully you should have everything that you need to be able to use that into your organization. Does anyone have any question here before I go back to my slides? I can always take questions later on, but just in case.
Can't see any hands raised, Harvey.
Okay, so I'm just going to go back to my slides, which are not too many. Hopefully, if I can find them. Come on, where is it gone? Do you see my slides?
Yeah,
Yes.
it's the beginning though, Parveen. You need to go towards the end.
Yeah, no problem.
That's it.
Okay, so now it is more about handing over the baton to all of you. We have developed what we could develop, which is relevant, theoretically robust. It's developed and influenced by developed by experts and influenced by expertise. It's a valid document, but it is up to you. How do you translate and use that, and how do you translate to action and implement? So it's up to you how you use it. As we have said, my preference have always been, and I've always suggested, use it as a validated tool, where rather than sitting with less number of people, if you could send it to the organizations or and each individual, I'm using the example of nurse here because it is about nursing. So each individual nurse who is then able to give you information. So then you'll be able to see that, okay, nurses in this particular unit are not aware of this, or nurses working at band 5 level perhaps do not necessarily know about that we have got a digital nurse in the organization, or mentorship opportunities available into the organization. And then that would allow you to be able to take that forward. But having said that, it doesn't stop you from kind of using those statements as a discussion points to be able to ask questions and do it that way. I think it's better to involve larger number of people to be able to give you responses, then look at those responses and go through the process of developing goals and looking at where your organizations, and developing realistic and smart goals to be able to go from one level to the other, depending on how bigger your organization and how bigger you want to do the work. Okay, so this is a long road, and we are at the beginning of the journey still, but we are making progress. Many statements for many organizations may look like aspirational because they may think we are not there yet, and they may aim for improvement, but you have to work with each other to be able to find ways to decide which level you're at and which level you're going to go for. What's happening next with the SOAR tool? We have managed to get a grant from University of Sheffield, and what we want to do is develop a digital tool of sort, which means that it would be a web-based application. And that's our vision. Hopefully it would look like that. It would be a web-based application where organizations would be able to pick and choose from some demographic questions or add some demographic questions in there, share the link with their participant they want to or asked to participate in, and once they have collected the data, hopefully it should give you some information and results related to your organization. So that's to help organizations and colleagues who may not be very confident or have less time in terms of developing those online tools, etc. So to enable that, but then at the same time, we would like our organizations to submit anonymous information. So we have got data from larger organizations, from different professional groups, to be able to develop that work further and to be able to take and see how we can learn from what we are doing. Maybe organizations want to work with each other to want to learn from it, or maybe we want to learn as to how to develop, which aspects to focus on going forward. So that's the start of the process, and we will hopefully be able to provide more information once we are getting through it and developing that further. Thank you so much, everyone. And this is our email addresses, myself, Julie, and Joe. And you can always get in touch with us for any questions or any help that you need. We envisage people probably would need help with the maturity metrics and planning the tool and how to take that forward. We'll be able to help and support with that. But this is a tour for the SORT tool. I hope you found it useful. And now our panel would be very happy to take any questions that you may have. Thank you.
No, I'd like to sort of say thank you very much, Parveen, for sharing the information from the team. I think I'd probably like to have a little bit more nuanced and balanced opinion about how the SORT might be used. I think very clearly, it is a validated and reliable measure now that it can be used as a questionnaire. But I know some organisations, they may be quite, not far on. They may not have access to statisticians or statistical help. So, I do think that using it as a reflective tool with a group of people that are hopefully a large enough group, where you actually record your methodology and do the same, to help plan into the future. I think, it can be useful both ways, I think. And certainly when we did some of the collaboration with various folk, they were saying they'd probably like to use the tool in both ways, both as a questionnaire to think about measurement, but also a reflective tool to think about, how are we going to use our induction process? How are we going to measure it? How are we going to use our annual appraisal system? So that there will be a certain, as a group, you get some groupthink going and thinking, how are we going to move this in our organisation? So that's just sort of a little bit more of a nuanced approach, I think, with using SORT.
Thank you, Joe. Julie, would you like to add anything?
No, I think you've covered, and Joe also, and I think it's really important. I think the points that Joe made, and I think Parveen you made too, and Joe Cooper earlier on, is that we're looking at research across for nurses and midwives and our AHP colleagues across the board. So right through from engagement and really having that understanding that it is it's a journey and not everybody's stepping on and off at the same place. And I think that's crucial to kind of collaborative development within our profession.
Thank you, Julie. Over to you, Joe Cooper.
Sure. Hi. There's just a question in the chat about when do you think the digital version will be available? So is there any further kind of sense of timeline on that?
So it would hopefully be available. We have got about a year. So we are starting next month, so May, June time, and hopefully before next year, June, it will be available as the final version. Having said that, there may be, we will be coming and asking people to use prototypes earlier on and to have some inputs in there. So that's the final timeline, but hopefully it should be available, I would say, by next March. But then you never know, things change. But that's the timeline that we're working towards.
Can I just say, I think, the opportunity of learning and doing research, across organisations, once we have got it online, we could do it anyway, but if we do it online, there may be, especially if people will share their data and think about their action planning and how things might change over time, we might learn quite a lot, so sort of in a real sort of real-time event, if you see what I mean. And also I think the potential for communities of practice where similar organisations come together, do SORT together and learn from each other, and and share how they're progressing using SORT as a validated tool. I think it's got great potential, and I think will be more so on when it's online.
Thank you, Jo. There's a question from Sam about, other than face validity and principal component analysis, how has the tool been validated?
So Sam, it depends on what the question that you're asking, but in terms of the face validity and principal component analysis, that's what we've used. This full SORT tool has been developed in terms of with the experts through using a participatory approach and various cycles of where we have developed something, got the feedback, changed it, and have gone back and forward. I'm not entirely sure if there is what specific question you have in your mind, and I could answer it that way if you have, but we will soon have papers published from the tool, and that would give you more information. But please feel free to ask if there's any specific question that you wanted to ask.
I'll add as well. I mean, obviously, the initial statements, the items were generated from research evidence and from theoretical literature, particularly my framework, that's the most highly cited framework in capacity building, and also realist review. So it's sort of really embedded in evidence, and you can see that. But I suppose the whole Delphi process is using experts, and they were chosen for their experts around supporting research and research capacity development. And so in terms of face validity, both theoretical strength and face validity is really there, I think. I mean, obviously, we will get to know that there's not masses amount of research around capacity building at organisational level. There's some, but the potential for learning together using SORT is just great. So we will learn as we go along around what works for whom, where, and when.
Thank you. Thanks, Jo. And we've got another Jo, or Joanna Smith. Would you like to come in, Joanna, and then I'll pose Claire's question?
Oh, thanks. Thanks, everyone. Yeah, so I'm actually Jo Smith, but officially Joanna. Thanks, Parveen and everyone. Parveen, I just want to ask, I know we've talked before about SORT. When the digital version goes live, how will it work in terms of if an organisation wants to use it, will they just use it independently, or will data feed into other organisations' data collectively and then divided out? Does that make sense?
Okay, so what we are hoping to do is that in organizations or groups are able to generate a version of it for themselves, and which they are able to collect the information, analyze it, and be able to get some results from it as well. So some graphs and charts and stuff, and some interpretation, so they could see what's happening with it. What we hope that they would allow us to use anonymized data at the back end, where I'm conscious of what I say. It's not that we would like to compare organizations, but it's more about developing tool and developing resources around the tool. But one aspect could also be that we have got bigger data that we could then analyze and see which direction we are going. But it all depend on the permission and the willingness of the organization. So that's one way of doing it. On the other hand, if the organization just wanted to use tool for themselves, we've developed this under Creative Commons license, which means that you can use the tool and you can develop your own kind of online using, I don't know, SurveyMonkey or Qualtrics or Google Forms or Microsoft Forms, any of those measures to develop your own tool and use it and analyze it the way you wanted to do it within your organizations. I hope that gives answer to your question.
Yeah, I suppose it's too early to answer some of the technical questions, because I think having a collective view, not necessarily comparing organisations, would be really useful. Yeah. So eventually how that all links would be, I know that'll come out when you start developing it. So I think a digital tool for me is always really helpful.
Yeah,
Anyway, thank you.
we are looking for co-production partners. So,
Just gonna
just using this as an opportunity. But I think just to clarify, the whole idea would be that the tool would help the organisation do something online and help to analyse the data, but there would be an opportunity to share the data anonymously if you're willing to do so. And my view would be that, not all organisations are the same. So a social care organisation or a primary care community organisation will be very different from a teaching hospital, for example. And so we might start to think about what things work in different contexts. So it's that sort of more underlying research questions about, if they have different organisations, what works for them, and but doing it in real life time in a way. So hopefully it would be a really, really useful thing to share as a community.
Thank you, Jo. And just to reiterate that the point of a maturity matrix was not around a RAG rating system where people are either good or not good in research. This is around where you're starting, and having a sense of whether there is or isn't a plan in place is improvement, because you are getting a sense of where you're starting from. And that is the point. The learning is as much in the process and the journey, hence why to keep a record and to know how it's done as to what that then looks like on some sort of a matrix. That's really valuable to keep that in mind. Just to bring a question from Claire, thank you for this. This is around about whether there's been any piloting of this, and can their experience in using the tool be shared? I know we've had a lot of engagement, but is there anything to say about that? I don't think there's been any specific piloting, but I can see Kathy Henshaw was on. There is a commitment around the NIHR senior research leaders. Kathy, not to put you on the spot, but if there was anything you wanted to say, please feel free to come in. I think there is a commitment to looking across the senior research leaders and how they might utilise this as part of their programme. Anything else to add, Parveen or Jo? Have I kind of answered that?
Kathy has been involved from the start of it, and we are and there are two individuals from the program who are leading on this, and hoping that all individuals into the program would use it would use and pilot it into their own system, maybe slightly differently depending on the needs of those organizations, and we will be able to learn in those different contexts, and we'll have more learning about this as yet. As for the piloting is concerned, we haven't, as we've said, that we've done the psychometrics and everything for the tool, but not for the maturity metrics and the whole process of it. We did some workshops and have got feedback, and people had different ideas as to how that can be used, but we haven't done anything in terms of implementing it and in terms of piloting as the whole thing, and to be able to learn that. Jennifer has a hand up, and I think you've asked Kathy. I saw her somewhere here.
I think she's
I thought I'd jump in instead if Kathy, oh, there she is. I just wanted to say that, yes, that's the intention, is that the senior research leaders, the subsequent cohorts will continue to be engaging with the tool. It's been, as you know, a long anticipated outcome, and it's been very exciting that some of our colleagues have been able to support it and help develop it. So that's very much the intention going forward.
Thank you.
Yeah, and just to say as well that I think part of the, sorry, my camera's off, part of the way that our senior research leaders are using the tool is also to use it as a way to assess their own development as senior research leaders. So it's being used as a tool to aid their progress across the 3 years of the programme, which might also then mean that they become the leaders in their organisations in implementing the SORT. Or it might not, but either way, it's going to help with the raising awareness about the tool and how it can be used. So that's a really positive thing, and we're continuing to work and develop that as we go. So yeah.
Thank you, Kathy.
And just to add, depending on what is it that you are, because your goals could be very different depending on the results that you get and who your participants were, what type of organization you have, and so some may want to focus on maybe one area of the organization. Some may want to focus on one aspect of the work, like, for example, digitally enabled research or something else. There could be different iterations or different ways of focusing in different places, depending on your needs and the results that you have. So it would be quite different depending on what you want to do.
Thank you. And another great way of using it for personal development, which is what this SRL programme is really brilliant for. See a great comment there from Sam around using it at ICB as part of the ARC network. Great to hear. Love to learn more about that, Sam. And we are in NHS England working closely with our regional chief nurses and their leaders for research, and of course our ICB chief nurses on research more broadly in the strategic plan, but within that, the SORT, which is a key deliverable as part of that. So it would be great to hear more. And you're absolutely right, sharing it is so important. Just Ellie, reading your comment around the potential and power of it in terms of getting a real sense of grassroots. Great to explore critically appraised groups and partnering with that. And I did see an earlier question from Tim around the alignment, we get it right, with Karin's survey. Anything to say around that, Parveen, Joe and Julie, about how we really do something and do it well as partnership around Karin, because that has some similar elements but not the same.
Okay, Joe, do you want to say something?
Well, no, I just think, I mean, I would thought Parveen and Julie, you're both joint appointments here, and I know that, you know, you can use these together. There will be some overlap. I think it's important that this is, I think it's about understanding the planning process as well. It's getting your sort of baseline, but then actually using that to plan change. But I think, you know, they're just, you know, how do you view Rome from different hills? And you might get different perspectives from. I mean, I think that you know, I feel that this is fairly well robust in terms of theoretical underpinning and the fact that we've developed in a way that hopefully will be more be quite actionable, and that's what we want from it. But I think you could do both, and I think both Parveen and Julie, you've been using both, have you not? Or
Julie, do you want to say something?
Yeah, just to agree, Joe. I think I think there are some similarities, but they ask different questions, and I think that they're both useful in their own way, I think.
So myself and Sam recently used not the SORT tool as in its current format, but the Karin completed that survey. And of course, we've been kind of, you know, looking at the SORT and being involved in it. So both, as Joe and Julie are saying, are asked different questions, but they complement in terms of your understanding of the organization and what's happening into one organization. Karin provides you more with sort of overall information as to what's happening in the organization, how many positions you have for this, that, the other, whereas SORT would allow you to see, as it says on the tin, to be able to assess which level or which place you are and where do you want to go from it. So I see this gives you more granular sort of aspect, and the other one gives you more broader sort of figures around it. So I think both are useful and both can be quite complementary. If Karin is going to use any organization, as we have said, it's in developed under Creative Commons license. So any organizations would be able to pick it up from NHS England's website and use it, or once the digital tool is enabled, to be able to do that, or can come back as a combined organizations can use that too. Thank you.
Thank you. And just for those who may not be familiar, Karin is the Clinical Academic Role Implementation Network. If you look on the Council of Deans for Health website, some phenomenal work led by Professor Jane Code and across the 4 countries around organisations looking to develop clinical academic careers. I wonder, Mark, I can see you there. There's a question from Helen around what do we think is an organisation in relation to SORT? You know, is it about strategic overviews, system-wide or more? Have you got any thoughts on how best we kind of use this, both from local to system level?
Yeah, thanks, Joe. Really good question. One of the things that we've really been keen on developing, of course, is greater levels of collaboration, because organisations come in all sorts of forms and sizes. So one of the kind of system level opportunities is that we've been discussing with the Chief Nurse of Social Care, Deb Sturdy, is how do we get social care homes and others who have a number of nurses working alongside them to support research activity, to be more interested in research outcomes, which for many working in social care may be not possible unless they collaborate across a system, either at HEI level or perhaps within NHS Trust. So for me, it could be a university teaching hospital as one organisation assessment, and the board would be very interested in that for obvious strategic reasons. You might be a relatively medium-sized district general hospital who provides community services or mental health services, and actually you might want to then collaborate across 2 or 3 universities to ensure that you've got a strategic intention around research. Or you might be a really small organisation that actually would benefit from being a hub and spoke model with a larger one when they're undergoing their SORT assessment. So the short answer is all of the above. I don't think we should be limited or bound to kind of organizational sovereignty or necessarily some geographical positions, because I think the SORT tool plus, I think the kind of nature of how people want to work against the CNO strategy for research means that actually we can start to think about atypical relationships in the research space that will ensure that we're able to A, expand our influence, but B, also importantly, perhaps tap into some parts of sectors that wouldn't normally have access to this type of research activity in some cases. So I think there are lots of opportunity.
I can reinforce that really. I mean, a lot of the literature around capacity building, research capacity building is actually saying, actually it's a social movement. It's about addressing inequalities. And I do, and thinking about working with service users, developing research that's useful to the organisation or using research in a way that's, so I think, it can really work, I think, both in as Parveen was saying, within a department, if that you wanted to do, or you could work it in the wider system. And I think the idea of ICBs linking this across organisations, and particularly thinking about sort of the more embedding research in organisations and really thinking about, releasing potential. There could be a real sort of, movement here where you get things moving across and with each other. Patients and people don't just stay in one organisation, they grow across the system. And really, if we're thinking about doing research support, we should do that. But I want this to be a manageable thing, this is a tool that hopefully you can be creative and think about where your focus and boundaries are. I think it's robust and flexible enough to do that.
And I would just would give you a very practical sort of aspect. This is a question which has been asked a lot. But if we also know from sociological literature, what is an organization? Organization is a group of people organized in some ways doing something. So how you define organization depends. If it's in the context of if I take example, I don't know, a DPTH or STH, it could be the whole organization, and there are different hospitals which are attached or available within the DPTH. And we take DPTH as organizations and sub-part of it. It could be one hospital with various wards as some components of it. If it's initiated by NHS England, for example, so different NHS provision across the country, would NHS becomes an organization, the bigger one, and the other becomes component. So I think it depends. It's what is it that you identify as organization, and how far do you want to take it? So some of that depends on how you define it and what your focus you would like to be.
Thank you. Thanks, Parveen. I can't see any more comments or. I've just got one come in. Would be interested in learning more about the multidisciplinary aspect, pharmacist embedded in research. Anything? I think we've kind of identified that this came from the nursing strategic plan, but it's very relevant for multidisciplinary. Is anything people just wanted to kind of highlight in relation to that?
I just think, obviously it was commissioned by the Chief Nursing Office, and the focus that, the remit was about focus on research capacity for nurses, but the evidence we used and the experts we used included a wider group. So obviously we produced this tool in respect to, the tender, but I do think it's fairly, well, it will be, I'm sure, relevant for HPs. And obviously at the moment, SORT says, nurses within our organisation or but you could substitute that for an AHP. But you know, ideally, we would like to do factor analysis on that, just to make sure that it's robust and valid for those groups. But theoretically, it should be. You know, these things are. But the thing is, we do know there are differences between different professional groups and their ability to, you know, in their career pathways or the support that they receive. So. But the concepts that we're using, the items linked to the sort, they are, you know, are universal across professional groups. So I suppose what I'm saying is, we didn't consult pharmacists. We consulted a wider AHP group, but, you know, feel free to use it and let us know. You know, I think that's the thing. And it obviously, the other issue would be, and I noticed some of the other comments. I mean, the focus is about developing capacity in health and care organisations. And that's where the focus and hopefully where the impact will be. But part of that is working in collaboration and looking outside the organisation. So the idea of pharmacists working with their local research teams in the universities is, you know, is a real potential. And that's the sort of spin-off of using SORT, is that you develop these collaborations that is really moving things on.
Wonderful. It'd be great to have a meeting this time next year. Perhaps that's our challenge, to come together and celebrate and learn further about where the impact has been and how it's both supported us personally, professionally, but also, of course, our organisations, because where we get more research, we get better patient benefit and patient outcomes, and that's what we really want too. So thank you very much for that, and just so proud that, you know, this tool has been developed, of course, for nursing, but by nurses, and I think that's also brilliant. So congratulations to the team for doing this on behalf of all professions, really, and organisations. So I think we're kind of there. I can't see any more unless I've missed any, team. I just wondered if I could hand over to you, Mark, to kind of do a bit of a summary and perhaps draw us to a close.
Just give me one
thanks,
sec.
Jo. Sorry, apologies, Parveen.
Sorry. I'm just only saying, just give me one sec so I could check YouTube if there's any questions.
Oh, sorry, fair enough. Gosh.
So we could include them. So there is one comment from Ellie Dring, and we're using our Karen survey results to contribute to the evidence for SORT, and a digital version of the tool is great news. But
Fabulous.
There's nothing else. We've got about 15 members watching on the YouTube. So I just wanted to make sure that they feel included as well. Thank you.
Thank you. Thanks, YouTube participants. Over to you, Mark. You're muted now.
I'll come off mute and then I'll be able to talk. Thank you, colleagues, for joining today. It's been a really rich and really helpful discussion. Thank you for those colleagues who have contributed through the chat box and obviously on YouTube as well. I'd just like to say once again a huge thank you to Professor Ali and the team, who have been doing a huge amount of work to develop this. It's really landed very well, and of course the team nationally have been supporting the development of the CNO strategy and now into our delivery phase. There is real opportunity through research, and I think you've heard a lot today about how that is going to be delivered through greater levels of collaboration across systems, but also supporting organisations to deliver better outcomes as a result of learning and understanding more about research, the use of evidence base, and also importantly driving change in clinical practice through that evidence. So we're really delighted there's been so greater an interest in the SORT tool. It's highly anticipated, and we look forward to seeing the event and the impact of this in future iterations. And I'm sure we'll be doing a future webinar where we can talk about some of the case studies, the examples that organisations have done in relation to use of this. So we'll draw this to a close. Just to say once again, thank you to the team who have pulled all of this together. These events never are easy to organise. There's a huge amount of tech that goes in behind the scenes and preparation. I just want to say thank you to the team that got this to this stage, but also importantly, we look forward to working with people across the system to improve research capability in the NHS and wider. Thank you very much, colleagues. Enjoy the rest of your day.
Thank you. Bye.